So being a foot doctor, I often get many people coming into my clinic and wondering if their big toe is broken or just sprained. So there's a few different ways to determine whether your big toe is broken, and that's what this video is going to be about. So make sure you stick around till the end. The sawbone, you can see that the big toe contains two bones. We call this the proximal phalanx, and then the tip of the toe, the distal phalanx. And these bones are supported by tendons and ligaments, which are an important part to foot mobility and stability. So fractures in the toe can be caused by a lot of different things, and some of the reasons people can get a big toe fracture is from direct trauma to the foot, such as stubbing the foot, specifically the toe. Crushing injuries can also cause fractures of the big toe, like from a heavy object falling on the toe like a barbell. And also overextension during activities that press on the big toe, like from ballet or even like running, can cause fractures. It's important to diagnose these fractures early to ensure that it heals properly. What are the symptoms of a broken big toe? So a broken toe might present with several different symptoms, and some of the symptoms include swelling and bruising. And after injuring your toe, if you notice immediate swelling or the toe turns into shades of blue and purple, this could indicate that there's a fracture there. And the discoloration basically occurs due to the damaged blood vessels in the area. Another indication of a broken toe is if you have a subungual hematoma. And this is where the blood accumulates under the great toenail after trauma. And the presence of that blood-filled area beneath the toenail, is an indication that the toe itself might be fractured underneath the toenail. And also the pain. So after you break the toe, you'll initially feel a sharp pain, but the pain can be dull and persisting for weeks if the toe is broken versus if it's just injured. And also another thing that you might notice is alignment issues. So after you have the injury in the toe, you should kind of examine the big toe closely. If the bones are shifted or the toe is rotated out of its natural position, that indicates that not only could the toe be broken, but it could be dislocated. And a quick tip to help to check is by looking at the big toenail. It isn't facing in the upwards direction as it usually is. The underlying bone may be broken. And another tip too to look out for is whether there's restricted motion in the toe. If you notice that bending the toe joint is painful, then, signify that that toe is actually broken, and that's what makes it difficult to bend. If you have a toe fracture, make sure you see a foot doctor. Your doctor will go ahead and perform a physical exam and also check to see if the alignment in the toe is okay. They'll order an x-ray directly in the office to see whether the bone is broken and how badly it's broken, whether it's dislocated, whether it's not in proper alignment, and that's going to dictate treatment. Before you see your doctor, though, make sure that you're icing and resting the toe and just kind of minimally weight bearing until you're able to see your doctor. If possible, you should buy a surgical shoe. I'll attach a link in the description for you guys. It's basically a stiff shoe with Velcro straps that force the big toe joint not to move, and this can help with the healing process, but I would get that surgical shoe first while you're waiting for your doctor's appointment so that you don't do any further injury. So once your doctor diagnoses a big toe fracture, if the fracture is in proper alignment and it's just like a small crack, your doctor will actually have you remain in that surgical shoe for about 4 to 6 weeks until the fracture itself heals. Now, if the toe fracture is pretty severe though, and there is, significant alignment issues in the toe, your doctor will actually recommend surgery because the big toe is super important for walking, and it's important that that alignment is fixed. And usually the big toe fracture can be fixated using screws in the operating room. After surgery, you'll have to stay weight bearing again as tolerated in a surgical shoe or a cast boot until the surgical site heals, which will typically take at least 4 to 6 weeks. And during that time, you don't want to make sure to do any type of heavy activities, no running and things like that until the bone heals. And that's the misconception, is so many people think that with toe fractures, nothing can be done, but it's just not true. If the alignment is not there and the fracture fragments are super shifted, usually surgery is indicated to fix this to ensure that it heals well and not just like crooked. Now, after about the 6-week mark, if your doctor confirms on the x-ray that the fracture's healed, you can usually resume your activities without problems. And some of the complications that can happen from not getting a toe fracture fixed is that you can have malalignment of the joints, you can have continued pain. A lot of times when people injure their toe, they also injure the nerves in their toe, and so you might have burning and tingling sensations in the toes that just doesn't go away. So there's a lot of reasons to see your foot doctor to make sure that, the toe fracture is healing the way it should. That's it for this video today, guys. If you guys found it helpful, make sure to subscribe for more videos just like this one.